I'm Dr. David Weinstock. I work here at Grove Medical Associates. Been here since 2003. It's a private practice. We have 6 providers now full-time. And we've been using eClinicalWorks from about 2005 for about a good 10 years. The connection with the patient is definitely changed. I think that when they often felt that they might be seeing you once a year or vice versa, that was it. They would leave here and that was it. But knowing that they could communicate back and forth and they can send messages, I can answer them. As far as wearables go and engaging those patients, I recently had a patient about 3 months ago now who has always had a borderline blood pressure. We've talked at length about his blood pressure.
Between the iHealth blood pressure and the Withings watch, and then all connecting through the healow website, Dr. Weinstock has the ability to see it at nighttime before I go to bed. If I take it in the morning, he can see it. 31st of July, 7:30 in the morning. So I was just ready to go to work, and I said, oh, I feel that pain in my chest, heaviness in my chest, and sweating and some pain down the arm. And she goes, take your blood pressure. So because I had the equipment here, I went and I took the blood pressure again, looked on my phone, and it was 199 over 118. And I says, whoa. She goes, that's it. You're going to the doctor.
He was able to realize, okay, I'm not feeling good. My blood pressure's up. I can't fool around with that. It made sense the emergency room was the appropriate place to go and not wait. He could articulate to the emergency room, here's my record, here's my blood pressure from the visit, here's my labs from last week. It allowed the emergency room to have a lot more information at the time he presented as opposed to trying to figure out what was really going on.
Several hours later, the test came back where the enzyme showed that I had had some type of mild infraction.
You can say heart attack.
Heart attack.
Jody?
So Jody was another patient who's always tried to be healthy and try to live a healthy life like we all do. But sometimes it takes a little bit extra work.
I've seen my blood pressure improve just in 3 months. So it definitely does work. And I really think that's the awesome part of this whole the iHealth, and at least with the activity tracker.
I think that the healow app is a great part of our philosophy here at Grove, where we're partnering with the patient as patients can see how their lifestyle affects their health. It's not about us here at Grove as providers, it's about us as providers helping the patient get to where they need to be. And you really develop a good, strong relationship with these people that you've been treating for years, and you maybe come to realize you really didn't know all that much about them. It makes for a really nice, strong community of patient-provider care.
Just knowing that healow is allowing my doctor to see what's going on in my life right on his computer, and then when you get an email from him, you know he's looking at that, and it's like you're being watched by the doctor at all times.
And if there are issues, at least he can address it. I'm grateful for that.